Let's talk about similarities. How are circus artists like other orthopedic patients? What's the similarity there? How do they cross over?
They still have bodies, right? We still have the same joints, muscles, tissues work the same way. The other thing is they cross over a lot with other sports, with other activities. Circus artists need full shoulder range of motion. So do your gymnasts, your CrossFitters, your climbers, and they need to have strength and control up there. But also, so does the person who needs to put a glass away on the upper shelf. We can do better in understanding what has to happen at those end ranges when we're working with our regular orthopedic patients and our circus artists. So that's where the real crossover is with our orthopedic patients, we really focus on that mid-range activities and mid-range strength. And even with them, we could be better at working on that end range and giving them back that true function throughout their entire range of motion that the circus artist needs, but that orthopedic patient still also should desire.
So let's go the other way. I mean, you know where the next question's coming, right? How are they different? Like, talk about the opposite.
How are they different? They spend a lot of time at that end range and then they load bear on it. So whether it's a tractioning force or a compression force, that end range motion is being loaded. And we need to understand those stresses on their bodies. They're also doing a lot of repetitive motion, often at that end range, in ways that are a little bit different. So they're going to use that hamstring through its full range of motion, though the norm, meaning the mean or the average of hamstring range of motion in the general population is, less than 90. A circus artist needs to use that muscle through its full length, and a circus artist normal may be a little bit different. So understanding that it's not a problem that they have more range of motion, how do we help them stabilize there, work there, move through it, and have the control that they need? So that's one. The other is they are the best patients in the whole darn world. Not that all our orthopedic patients aren't great, but circus patients, they are so, and this is at all levels, recreational through professional, they're curious and they are committed to getting their bodies working as well as possible. And so when you have a patient that wants to be on that journey with you, it's fun, right? So they're just really, really fun. They want to say yes and, if you go for that improv comedy world of things, they want to say, oh, yes, that exercise is great for me. And I took it away and applied it to this, this, and this, and come back to you, and they make me a better therapist. So in a very not about the bodies, but still about being a clinician in practice, they are the best patients to have. But I'm also very biased.
I like how you disclose your bias there. It's good.
Yeah. Nice. Oh, absolutely. Very biased.
Let's say a new graduate or a clinician who maybe is just starting to work with circus artists. What advice, piece or two piece, like something short, but how would you, if they said, listen, how do I work with circus artists effectively? Like what comes to mind, right?
Two things. I'm going to start with the question you actually asked. So what comes to mind first is listen and ask questions. A lot of these circus artists aren't disclosing that they're training circus, especially our pole dancers, which are on the fringe of circus, but are considered part of our community. They're not necessarily going to disclose to you that they're circus artists because they're afraid you're going to tell them to stop. Think about your runners. Think about your other athletes or passionate humans about their hobbies. They don't want to stop. So if they think you're going to say, well, stop doing that for now, or let's just stop doing that, that's going to be a problem. So really, really listening to them and then asking questions. Oh, what do you do for your hobbies? Oh, you're hanging from things. What does that look like? Having key words or phrases is huge. If you can have the key words or phrases like, what is your discipline? What type of apparatus are you using? You don't have to know all the different things, or what skills are you working on? Just by asking those questions, you've opened the door for them to tell you more about what they do and for them to feel a little bit more comfortable and more accepted. And then everyone these days has videos of themselves or their favorite instructor on their phone. So, okay, I have what's your discipline? Bankin. Huh, interesting. What is that? Do you have a video? Now you've engaged with the patient and they know you're interested and they're going to be more willing to give you the information. And they do have a video, and understanding the biomechanics of movement is what we do. So being able to look at that video and help them break it down and understand where their pain and problems are coming in is huge. The other thing is you're already seeing circus artists. As I said, they don't necessarily disclose that they're training circus arts, but also circus arts in the US has grown exponentially in the last 10 years or so. The biggest peak in circus schools opening or circus studios of different sizes is about 2012 to 2015. Some closed during the pandemic, but there's more ones are starting to open up again. We're talking thousands across the US. I can think, in my community in Seattle, where I am most of the time, we have 3 or 4 large schools. And I think the last count, I had 14 or 15 studios of different sizes. So they're everywhere. And then my lovely husband and I live in separate places. In his small town in Oregon, there are 3 circus schools.
Wow.
Right. So they're everywhere. So if you don't think you're seeing a circus patient, you are most likely. And if you haven't, you will. So this is a really great way of talking to the population, is having some words, some key phrases to kind of pepper in there to help them feel comfortable.